All right, let's dive into something that sounds like it's straight out of a detective novel. We're going to figure out how you can map the exact shape and size of the human heart, but without a single X-ray, no ultrasound, none of our modern imaging tech. Just sound.
So you're probably wondering, how on earth is that even possible? How can you get a detailed picture of our most important organ when it's tucked away deep inside our chest? Well, the answer is surprisingly simple, and it has everything to do with what you can hear.
The technique is called percussion, and if that sounds complicated, don't worry, it's not. You know how you can tap on a wall to find a solid wooden stud behind the drywall? You hear that sound change from hollow to solid? Well, this is the exact same idea. We're just looking for the heart instead of a stud.
Okay, so how does this actually play out in a real exam? How do a few simple taps on the chest turn into a detailed map of the heart? Well, it's kind of like creating a connect-the-dots picture where sound is your pen.
What's so cool about this is how methodical it is. A doctor starts tapping in the spaces between the ribs, right over the lungs. The air in the lungs makes a nice, resonant, almost hollow sound. They tap, 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 moving closer to the breastbone, listening for one tiny change. The moment that resonant sound suddenly goes thud, a dull sound, that's it. That's the edge of the heart. They make a little mark on the skin, move to another spot, and do it all over again. Dot by dot by dot, an outline starts taking shape.
Of course, before you can find anything weird, you have to know what normal looks like. You need a healthy baseline. This is the reference map that makes all the detective work possible. So here are the key landmarks of a healthy heart. The most important one is this feature called the heart waist, which you can usually find around the third rib. On a healthy heart, this waist creates this nice, gentle angle that opens up to the outside. You could almost think of it as the heart's signature look. Now, here's another really important measurement to keep in mind.
So what's this 5 to 6 centimeters? That's not the whole heart? No, it's a different landmark. It's the normal width of the vascular bundle. You know, that big cluster of major blood vessels at the very top of the heart? And besides just checking the heart's overall shape, percussion lets a doctor measure this specific area. If it's wider than it should be, that can be an early clue that something else is going on, like a dilated aorta.
And this is where it all comes together. Because when the heart is sick or under a lot of stress, it literally changes its shape. And these different outlines give us incredible clues about what's going on inside someone's body. This table breaks it all down. For instance, you get what's called a mitral configuration. Here, that heart waist we talked about flattens out, or even bulges. That points to problems with the mitral valve. Then there's the aortic shape, where the waist is really sharp and defined. That's often a sign of an enlarged left ventricle, maybe from high blood pressure. And then there's this trapezoid shape, where the whole bottom of the heart outline gets wider, a classic sign of fluid building up around it.
Let's really focus back in on that heart waist, because it is such a powerful clue. You can really see the difference here. In that mitral shape, it's the upper chambers, like the left atrium, that are getting bigger, and they physically push the waistline out, making it look flat. But in the aortic shape, it's the big powerhouse pump, the left ventricle, that has grown. It actually pulls the waist inward, making it look super sharp and distinct.
And check out this description for that aortic configuration. It's so vivid. On an X-ray, the way the left ventricle gets bigger makes the whole heart look like a boot or even a sitting duck. It's a fantastic image, right? Once you hear that, you'll never forget what that shape means.
So let's put it all together. This isn't just about drawing funny shapes on someone's chest. It's about translating those shapes into really powerful diagnostic information. So, to sum it up, each of these outlines tells its own story. That flattened waist of a mitral shape, it guides a doctor to think about valve problems. That defined boot-like aortic shape, it's a classic signal of high blood pressure. And that wide trapezoid base is a huge red flag for fluid buildup. It's basically like reading a health report, written by the heart itself.
And that's what's so amazing to me. In our world of high-tech scans and incredibly complex machines, this simple, elegant, hands-on technique, just tapping and listening, can tell us so much. It connects a doctor to their patient in this really direct, human way, using nothing more than their own hands and ears to figure out what's going on deep inside. It really makes you wonder, doesn't it? If a simple tap can reveal the entire story of the heart, what other secrets is the body just waiting to tell us, if we only know how to listen?